Welcome everybody as you come in. Thank you for joining us today. We'll get started when we have our quorum of people coming in. Welcome, welcome. Okay, I think we should go for it and get started. So welcome to the Park Slope Parents Lunch and Learn. And we have partnered with New York-Presbyterian Brooklyn Methodist and are excited to present to you. And I'm gonna be very open here and say my kids didn't eat much, so I should have gone to this lunch and learn 20 years ago. So happy to provide this forum for these great set of people to come and tell you. We have just such great experts to tell you how to make your child's first foods and getting them into eating to be something great. So I am going to turn it over to Stephen Beasley, who is going to get us started, introduce people, and make things happen.
Yes, I am not sharing my screen at this point. Excuse me for just one moment while I get everybody's bios up. We are so appreciative of you all sharing your time with us today. I'm Stefan, I'm the Community Affairs Coordinator here at New York-Presbyterian Brooklyn Methodist Hospital. I have an 11-month-old, so I am very much looking forward to our talk on today. So who we have coming up to share with us first is Aleksandra Popkowska. She's a neonatal and pediatric speech language pathologist, internationally board certified lactation consultant, and certified neonatal touch and massage therapy provider who currently works in the neonatal intensive care unit at New York-Presbyterian Brooklyn Methodist Hospital. Alex obtained her master's degree in speech language pathology from New York Medical College in Valhalla, New York, and completed her clinical fellowship in neonatal and pediatric speech language pathology at New York-Presbyterian Brooklyn Methodist Hospital. In her free time, she enjoys reading thriller novels, playing with her kitten Binks, and taking walks around the water by Hoboken with her partner Danielle. Next up is Dr. Shuchi Jani, a pediatrician and pediatric hospitalist at New York-Presbyterian Brooklyn Methodist Hospital. She received her medical degree at St. George's University, then went on to complete a pediatric residency program at Nassau University Medical Center in 2016. There, she received the Beth Seton Award for Education. Dr. Jani went on to practice hospitalist medicine at University of Maryland Medical Center, St. Joseph Hospital, and served as a clinical associate professor for the University of Maryland School of Medicine. In 2019, Dr. Jani joined the MIP family, Brooklyn Methodist Hospital, where she served as the interim associate site director for pediatric clerkship. We have also Helen Conza, who is the Assistant Director of Clinical Nutrition at New York-Presbyterian Queens. She received her Bachelor's of Science in Dietetics at the State University of New York College at Oneida, I think it's called, and completed her dietetic internship with Sodexo Metropolitan at State University of New York Downstate Medical Center. Helen received her master's in nutritional science at Brooklyn College. Today's topic is near and dear to Helen's heart as she is mother to a 1-year-old eater named Olive. So with that, we are just, again, so happy that you all have joined us, and away we go with our presentation.
All right, good afternoon, everyone. Thank you, Susan and Stephen, for that wonderful introduction. So we will begin talking about the oral anatomy today, just so we can get a little bit of a foundation. Here we have a picture of the infant and the adult anatomy. And so of course there's going to be similar anatomy. You have your lips, your gums, your tongue, the roof of your mouth, the soft palate, that punching bag in the back of your throat. And of course, moving on down into the pharynx, you have your epiglottis, which is this little leaf-like structure that helps to close off our airway when we are swallowing, and our esophagus that will then go into our stomach. So the infant and the adult anatomy is pretty similar in that sense. Of course, there are differences in the sizes of the structures and their relative positions to our voice box and our vocal tract. And so in the infant, that anatomy is really suited for sucking, swallowing, and breathing from a breast or a bottle, and taking in liquid that way. Of course, in an infant, you also have the vertical dimension of the mouth is a little bit smaller, and the tongue does take up much more of the oral cavity as compared to an adult's anatomy. The infant's tongue tip will protrude a little bit more past the gums as compared to an adult's. And the pharynx, that back of the throat area, is shorter so that the base of the tongue, the soft palate where that punching bag is, and all those walls are in close proximity to help protect the airway when we're swallowing. And the voice box itself, the larynx, is actually a third of the size of an adult's. Now that's an infant. Around 3 to 4 months of age is when the infant oral and facial anatomy will change and mimic that similar to an adult. So that being said, that vertical dimension of the oral cavity will get longer, so there's more space for the tongue to move around. And that's something we'll talk about in the next slide. Instead of the tongue moving forward and back like suckling from a breast or a bottle, now it'll have more movement to be able to move side to side, up and down, and we'll have more coordinated swallowing, which will help us when we start to move on to different textures and consistencies. Moving on to our next slide for oral motor development. So I'm going to talk about these age ranges and stages a little separately, but do know that it's expected for all of these different movements to kind of work together as the baby continues to grow and develop when it comes to breaking down age-appropriate textures and consistencies. So around birth to 3 months, we'll see reflexive movements of the tongue, meaning the tongue reflexively moves forward and back to suckle milk formula from a breast or a bottle. Like we talked about before, around 3 to 4 months of age, that anatomy starts to change and those reflexes start to become more volitional, voluntary. So they start to happen when the infant would like for them to happen versus reflexively. Around 4 to 6 months of age, we're expecting better head control, increased jaw mobility, which will then give us more tongue movements because the jaw becomes much more stationary. And around 8 to 9 months of age, that's when we're going to see less of that tongue protrusion that sometimes we see when we start solids. That baby will be spitting that food out, because closer to 9 months, that tongue stops protruding forward and instead will lift up and back for a more coordinated swallow. And 10 to 12 months of age, we'll have much better lip stability, much more movement of the tongue. So it all kind of progresses really nicely. Of course, those movements get better, that coordination gets better for chewing, all up until 2 years of age. But that first year of life is really, really important for development of really fine movements for feeding. I've also placed ways to promote oral motor development. So of course, we want the baby to be able to be a supported sitter, and that tripod sitting of bringing those hands forward, being able, that core stability is still developing, that those abdominal muscles. Of course, having teethers, I like to introduce teethers around 3 to 4 months of age because the anatomy is all elongating, the tongue is starting to explore different planes just to kind of set the foundation for later feeding. And different types of age-appropriate textures and consistencies that I know we're going to discuss moving forward. So is my baby ready for solids? We know that the AAP recommends starting babies on solids around 6 months of age. But what we really want to look at from a motor standpoint is around 3 months, babies will start rolling. We expect, on the spectrum of development for them to be supported sitters around 4 to 6 months of age, closer to 6, where they're able to do what I said before, that tripod sitting, which what we see in the picture below. They are still developing those nice, strong abdominal muscles to keep them grounded and up. And crawling comes around 9 months. The reason why we look at crawling is because it's really important for head neck control, shoulder stability, core stability. I like to think that our motor milestones are really the foundation for those fine motor movements that we see right here, especially when it comes to feeding. Some other things that we'll look for is baby mouthing toys and objects. Teethers, are they opening their mouth to the presentation of a spoon? If you happen to be sharing meal times together, are they showing interest in the foods that's around them? Are they trying to reach for what you may be eating, or really staring and looking at your mouth moving? All these motor milestones, but also these different engagement cues that we're looking for that will tell us, I think my baby may be ready for a little bit of some solids. Some key concepts that we want to keep in mind that I do believe Helen will go into a little bit more within her discussion is the division of responsibility. And the reason why I bring it up is because it really is a foundation for me as a feeding therapist here in the hospital when I do see some of my friends in outpatient. To really discuss the importance of the division of responsibility and the responsibilities that caregivers and our babies have during meal times. Because not only are we looking at these motor development and these other developmental milestones and engagement cues, but we also want to make sure that we understand the relationship with feeding and the relationships with meal times in order to set a really great foundation and stage for continued feeding, since we know that feeding is very social. So for me to end things off on my slides, we'll just talk about some supportive strategies when introducing solids. So I like to think that the fine motor development that we see with our hands, it can be matched with the types of foods that you're going to present. So between those 4 to 6 months of age, those foundational motor milestones are still developing. We can introduce teethers or safe feeders, and offering different tastes through those tools. Of course, around 6 to 8 months of age, we will see more of an open hand grasp when it comes to grabbing food off of the high chair. And what's really great around that time is offering foods that are a little bit longer and wider in order for baby to be able to grab and start to learn how to self-feed. Of course, if we're offering spoons, a pre-spoon for dipping, like the one that's pictured below, something that you can dip and set on the high chair for the baby to openly hand grasp it itself and start to self-feed as well. We're not expecting any dipping and eating at this age. Around 9 months, we'll start to see that pincer grasp. So offering foods that are a little bit smaller in order for them to learn how to use those fine motor and start to self-feed as well. And these utensils that you can introduce will be a little bit shorter and bulkier in order to continue to use that open hand grasp and start to self-feed, maybe dip a little bit more, helping guide them to dip in any of the foods you're presenting. And from 10 to 12 months, these utensils we can start to introduce are a little bit longer with harder handles. And of course, introducing a straw cup, we can introduce after 9 months of age, and an open cup, interestingly enough, we can start introducing around 6 months. So of course, we know that we're going to be, for the first 12 months of life, breast milk, formula, via breast or bottle, that's going to be your main source of nutrition. But when you are introducing these complementary foods, it is also appropriate to start introducing other ways of accepting these foods from utensils, cups, and straws. So that's just a little spiel about that.
Great, thanks, Alex. So I'm Dr. Jani. I will continue on here, and I'm just really building off of a lot of what what Alex has already said. So just to give you a visual of what the stomach size is of a growing baby, we like to usually say for a newborn child, a newborn infant, the size of the stomach is about the size of the baby's fist. So that, you can imagine maybe an ounce, maybe 2 ounces of breast milk or formula can properly fit in there before some of it comes right back up. But obviously, as they grow, the stomach size grows too. And so around the time that they're ready to start really eating, the stomach is roughly the size of an orange or a grapefruit. So just as a visual, you can sort of see, and that's an expanded full stomach. So you can sort of expect that that's what their intake would approximately be. So how do we actually start solid foods and when can we start them? So Alex already beautifully pointed this out. It really does depend on their gross and fine motor development. So the AAP, the American Academy of Pediatrics, definitely recommends that solid foods be introduced at 6 months of age. That's the official recommendation. However, each baby's a little bit different and they might be a little bit earlier than that, a little bit later than that, depending on their motor milestones. So can your baby hold their head up? As it's just so important to be able to have that appropriate positioning the head without head lag, without the baby's head sort of falling back and the neck not being able to support the head, and being able to sit up so that the food goes appropriately. So you're decreasing the risk of aspiration or food going down the throat or the baby choking up or vomiting up the food. So all of that is really important. And yeah, do they look interested in what you're eating? Do they open their mouths when they see something? Does it look like they want it? Can they actually take a spoon into their mouth and actually push the food to the back of their throat? So it very much may be the first couple of times you try, you introduce a spoonful of some sort of a puree and it comes right back out. That's okay. You try again the following day. You sort of get them used to it. It's a practice in patience for sure. And it's just about getting them used to the idea of putting something other than breast milk or formula into their mouths. And the last thing is the baby double their birth weight? So generally around 4 months is when the birth weight doubles. And that's not a hard and fast thing, really more the gross motor milestones are what you're really looking for. So initially, the first sort of foods that are recommended are pureed foods, or things like rice cereal are also okay, but you're looking for 1 ingredient foods. So either a pureed sweet potato, pureed carrots, apple, rice cereal, something like that, 1 ingredient introduced every 3 to 5 days. So you initially want to start with anywhere between 1 to 3 tablespoons. So that's maybe 15 ml, so like a half an ounce to an ounce of food initially. Your baby may not take that much. We may be just doing a spoonful here and there, and that's fine, and we'll build up to that. But when you introduce the food, say, for example, you started your baby on sweet potato puree. So you want to follow up with sweet potato puree for the next couple of days before you introduce, let's say, banana, because you're checking for allergies. You want to see, is there a reaction that the child has before you go introducing a multitude of foods, and then you notice an allergy like a rash or something, and you're not able to pinpoint what caused the reaction. You definitely want to pay attention to foods that are high in iron, high in zinc. So these are a lot of your leafy greens, a lot of your vegetables, a lot of your rice cereals and things have fortification. So that's a great choice as well. You definitely don't want to put rice cereal or any sort of puree into the baby's bottle. You really do want to introduce this as a separate entity. And then, just like Alex said, you can sort of start to allow them to self-feed when the baby starts to bring their hands to their mouth, when the baby starts to be able to have a little bit of a raking grasp, is able to hold things and bring them to their mouth. And then obviously babies don't really have teeth and don't have that chewing and swallowing propensity at this time. So avoid anything that requires chewing. You really do want to just work on being able to introduce the food, push it to the back of their mouth, and bring it appropriately into the esophagus. So in terms of allergies, as a pediatrician, I get this question a lot. There's a lot of parents that are very, very concerned with, of course, introducing things, especially peanuts, things like milk. A lot of parents are lactose intolerant, and so wonder if the baby's going to have that same problem. But there really is no evidence that waiting to introduce a certain food actually prevents a food allergy. And this diagram here, this picture is actually showing the 8 most common food allergens and the most dangerous food allergens. So really if anything, the evidence is that introducing earlier tends to actually be improved outcome in terms of allergic reactions. For a peanut allergy, if there's a child with severe eczema or a severe egg allergy, you can absolutely do blood testing. Your pediatrician can do that for you. But like I said, actually introducing peanuts earlier actually it prevented the development of peanut allergies in high-risk infants. So the earlier, the better. And the best way to do that is, of course, not with peanuts, as I'll talk about later, or Helen will also expand upon, but something like a little bit of peanut butter mixed into breast milk, something that doesn't allow for too much gumminess or too much stickiness in the mouth and can go down easily, and just sort of giving that. The other thing that I say is that a lot of these parents, you guys might be breastfeeding, and if you're eating these things, even though of course the child isn't directly introduced to the food, it does still help with a little bit of passive exposure. So that might be an option too. The big joke is, if you're really truly worried, maybe if you're 2 blocks away from Methodist, you try it then, just in case you're worried about anything. So you can run on down to the emergency department if we're all worried about any sort of a reaction occurring. But generally, it's pretty safe to introduce, observe, like I said, not introduce a new food for 3 to 5 days, and then continue on. Okay, so soon you'll notice, you may be starting with just one thing at a time, but you'll notice that just the breadth, just the amount of different variety of foods that you're giving increases very, very quickly. So the next slide, please. Yeah. So here are some foods to avoid. Anything that requires a lot of chewing, like I mentioned before. And you really do want to give a variety of foods, but you want to limit kind of a couple of different ones here. So anything that's a choking hazard, hot dogs, obviously they're small, they're round, it's very easy to actually end up getting stuck in the trachea. Any chunks of food, anything that they have to chew, any whole grapes, same reason as the hot dogs, nuts, seeds, popcorns, things that are gooey or sticky or hard. These are all things that the palate is just not ready to accept yet. Rice cereals, while great, they shouldn't be your main item to introduce. We say to introduce whole milk around a year of age, but before then you can start to definitely introduce some cheese, some yogurt for sure. And you really do want full fat everything up until 2 years of age. After that, you can switch to skim milk, but just because the brain of a child, it develops the most in the first year of life, and it's almost adult size by age 4. So you really do want to feed that brain a good amount of fat. And so whole milk and whole milk products are a great way to do that. Also, of course, the added vitamin D and calcium is an added bonus here. Fruit is better than fruit juice. So definitely when you can do pureed fruits and things like that, that's better than doing juices. If you're worried, because a lot of parents notice that, of course, when you switch from doing exclusively breastfeeding or exclusively formula feeding to the introduction of foods, the poop changes, right? And sometimes it becomes a little bit harder, it becomes a little bit more difficult, and you notice that the child is having to strain a little bit to go. At that time, it's perfectly reasonable to introduce some water. New York City tap water is fantastic. It has fluoride supplementation in it already. And that's something that we urge once you're at the stage where your baby has some teeth and you want to start brushing those teeth with a fluoride toothpaste and, using tap water to allow that fluoride to build good, strong, healthy teeth. But so water is definitely the choice, no more than 4 to 8 ounces a day. And that's when your child is taking 2 to 3 foods per day, in addition to the breast milk or the formula. And fruit juice, really, it's a no-no. Every once in a while, it's fine, but at this age, certainly not necessary. So water's the way to go. And I think, is that it for me? Oh, right. Okay, thanks. So just in terms of getting used to the process of eating, you want to have a routine, just like you have a routine for bedtime, for bath time, what have you. You want to have a routine. And really the best routine is to have a meal around the same time with the family. So the child should be in an appropriate high chair, sitting up, taking the food either from a spoon or self-feeding, resting between bites. And family meals are really great because it allows for socialization. It allows for normalization of mealtime and of just that social development. And that obviously carries on into adolescence and beyond. And the most important thing for you as a parent to recognize is, I know that we want our kids to eat. And, you know, I myself have a daughter, and I'm always like, why isn't she eating? She needs to eat something. She's going to be hungry. But to sort of try to quell those voices in your head and trust that your baby knows when he or she is full, when he or she is wanting more, or when they're ready to stop. So just letting them follow those cues is really, really important for establishing a really positive relationship to food and to eating in general. And so I think that concludes my part of the presentation. I'll pass this along to Helen. Thank you guys so much.
Thank you. So I'm Helen. I'm a registered dietitian, and this is my daughter, Olive. And our favorite activity as a family is eating. So introduction of solid foods, I know that we've all touched on it. And it's really important to remember that when you're going to feed your child, breast milk or formula for the first 6 months is their primary source of nutrition. And then, as stated before by Dr. Jani, let the infant watch, mirror, and mimic. Aleksandra said this as well. Children will do what you do. You're their comforting adult, and you're their trusted adult. So watching you eat and showing interest, Olive didn't touch any food really till she was almost 6 months. Our pediatrician actually said she could eat rice cereal and purees at 4 months. So of course my husband was like, yeah, we're gonna go home and give her rice cereal. And I was like, no, we're not. She wasn't sitting quite with good min assist in her tripod sit. And also when I sat her at her, that's an up seat, I put her in that purposefully so she would be at the table at our level watching us eat. You can see the teether actually Aleksandra had in her picture is behind her. For a while, she just sat with us with teethers, and the teethers help to limit her gag reflex and also show that food goes to our mouth. And I didn't introduce food. I let it sit at her table, and then she decided when she was ready to bring food to her mouth. So as probably you can tell, I did baby-led weaning with Olive. So she led the show. And we only offered food between milk feedings, and that's because you want to introduce food when the child is calm, happy, awake, and alert. You'll notice this with everything that goes on with your infant. We don't want to introduce new things when they're not happy, they're upset. It's not going to create a positive relationship to food. And as a dietitian, that's something I really want to instill, is a positive relationship with food. And as you see, they start to eat more and more, these whole solid foods will replace meals, but for a while it's just snacks, and their primary is their milk or formula. And you only offer small amounts at a time, and you let the child decide if and how much is eaten. You don't want to overwhelm them by giving them this whole giant plate of food, and then they'll probably resist eating anything at all. The next slide, please. So a question that people ask is, what should my baby be eating? And as I said, I didn't start Olive with purees. She actually never had them and was adverse to them. So provide a variety of foods, taste, texture, color, size, and shape. Just like us, children eat with their eyes first. So providing different things, but as mentioned by Aleksandra, the first thing they can do is open and close that palm. So you'll provide foods that are basically like stick shape, and one risk to baby-led weaning is they will bite their own hands. So you want enough that will stick off from the end. Everything I cut for her was the length of my finger. And look for foods that are sources of fiber, iron, protein, and calcium. And as mentioned before, milk is a very poor source of iron. So you want to make sure that they're having foods that are rich in that. And you can have foods, as mentioned before, early allergens, so shellfish, fortified cereals are a good source, but shellfish you want to be careful of because they're rubbery and can pose a choking hazard. So we did things like shrimp cakes or fish cakes cut up real fine. Being mindful of sodium, babies are made primarily of water. So we don't want to dehydrate them. And many of the things that we tend to eat out of convenience are very high in sodium. So watching for things, making sure it's homemade sauce versus store-bought, or just looking for low sodium options. Like if you're going to give a canned vegetable, because those are a great texture, they're very soft, easy to prep, you can get the no sodium and just drain them. Same thing if you're looking for iron, beans are a great source, but making sure that you get the no sodium, or you can wash them until the suds disappear, and that means most of the salt is gone. Then you can always mash them, because again, we look for things that are not round, and beans are perfectly round and just like their little tracheas. So we want to be mindful of that. And watching for things that have added sugars. So as Dr. Jani mentioned, you can add yogurt and cheese into their diet before the age of 1. But for Olive, we always had whole fat plain yogurt, and she really liked that. As you can see, sometimes it gets thrown at the dog and hits the floor, but she really loved it. Cottage cheeses are great, fortified cereals, root vegetables like sweet potatoes, and animal proteins. And just remember, it can take up to 10 to 12 exposures, sometimes 20, for a kid to actually like something. So I'll hear many of my friends say, oh, they really don't like that. I tried to give it to them. And I said, did you offer it again? And I just put it on her plate and let her decide. And there are many things that now she really likes and eats. Next slide. As Aleksandra mentioned, something that's like the Bible of all baby-led weaning and dietitian houses is the division of responsibility. And I know Dr. Jani touched on it as well. The parent decides what's served, when a meal or snack is eaten, and where it is eaten, and the child's role is how much is offered and if it's eaten at all. There's multiple reasons. Structure and providing a routine is really great comfort for children. Also, it helps them learn what hunger is and what fullness is. Olive did experience that objective experience of eating too much and puking. She wasn't sick, she just overate, and she never did it again. And also something I have to explain when people watch Olive eat is she has we call them eat days, non-eat days, and we don't fret about it. Some days she wants to eat so much and she picks and chooses, and I give her more of what she wants. I provide a variety, and something I provide is always familiar along with something that's new. And she might choose to eat a lot more chicken and just a little bit of broccoli, but later she might have more of something else. So next slide. And then how to avoid picky eating. I see this a lot. And again, it can change. Children's palates change just like ours, but really that slow transition to solids and not forcing a child to eat and allowing them to be part of the table, ensuring happy, comfortable environment with minimal distractions. And something that's crucial about comfort, I don't think we touched on this, but if you see Olive's feet, they're touching the bottom of her high chair. And this particular chair that she has, I can move that bottom rung, but you can makeshift something, a pool noodle, a towel. Keeping a child grounded at their ankles, knees, and hips 90-90-90, we say, helps to keep them focused, and it lets them know where their little bodies are in space and time. Also, something I'm noticing as she gets older, her toys are set aside very close to where our table is, and those need to be moved, because sometimes that can be more fun and exciting when we get home from daycare, is that versus I know she is hungry too and needs to eat. And also I offer foods, but I don't force and we don't praise. We work on that a lot as a family. It's not a good job. She didn't do a great thing when she ate all of her food. She just ate her food and we move on. And something to think about as they get older, it's not bribing, not coercing, and not putting things on a pedestal. It's not if you eat all this, you get to have this, or just one more bite. I see a lot of my family members struggle with to fight an argument, and also understanding when meals are offered and what's a special occasion. So every day, but if you go to that birthday party, now's not the time to fight over how many bites they're having, but making sure that, that Monday through Friday structure is there. And that meal snack schedule, just an example, all babies and children eat differently, but Olive goes to daycare, hence I'm here. So she has her milk in the morning still, then she has her breakfast, a snack, her lunch, a snack. She also has a bottle in between, so we're still working on that. And then she has her dinner. So that helps them to understand fullness, hunger, and routine. And don't cater or replace. You don't want to start becoming a short order cook. If they don't eat, it's okay. They'll eat again. You provided something that was familiar. And also we try to provide Olive with everything we're eating, but with the proper modification. So Olive wouldn't be eating a raw carrot in that picture. Everything there is boiled and nice and soft for her. She also didn't get teeth until she was 11 months. So she had plenty of food that she could chew before she had teeth. It was just soft and malleable to her. So lead by example. Okay, next slide. And then just some meal prep ideas. I feel like I am raising a bodybuilder with the amount of Tupperware she gets. And trust me, I'm sure a lot of you feel this way. It can become really, really exhausting. But there's plenty of things you can do to have foods ready ahead of time that will be fine for them to eat. So fresh frozen or steamed vegetables are really convenient. They're a little bit more affordable. They can stay in your freezer. And once you steam them, they come to a great consistency. Pro tip, I always go a minute longer than the bag says for the steamers because it makes it nice and soft for her, especially with broccoli stalks and things like that. Poached fruit, especially in the beginning, when they can't have that harder, crunchy food, but especially like when Dr. Jani was saying, their bowel movements change, you want to ensure that they're having a variety of different types of fiber. So we did a lot of poached apples, poached pears, and we made sure to add seasonings to develop her palate. So she had things like cinnamon and different things when we poached them to a nice soft consistency. Hard-boiled eggs, super easy, because then you can slice them, and then she's getting a lot of good fat from the yolk, protein, and a lot of her B vitamins. We do 3-ingredient pancakes quite a bit. It's just, we technically make them 5 because it's wheat, egg, banana, and then we add cinnamon and vanilla for her. Then we just slice them up into strips, and they're perfect for her. Baked sweet potatoes, because they're a great consistency already. I use those spoons like Aleksandra showed, the starter spoons, so they're perfect for things like mashed avocado or sweet potato because I could preload and she could learn to eat with the spoon. Soft pastas with sauce, ricotta cheese is nice and low sodium, good protein, and a veg. You can prep that ahead of time. And we use the, not to name, but we use the bean pastas to give her some more fiber. Meatballs are great. You can make them yourself, and they're nice, soft consistency. Baked tofu for another source of protein. And again, she loves, she's quite the millennials child. She loves avocado toast. We do hummus toast sticks and ricotta toast sticks quite a bit, and lentil soups, again, nice and cool. She likes butternut squash soup, but these are all things that you can make ahead of time. Also, you can go to the next slide. I think I'm done, but As you see, Olive wears like capes or those types of bibs, but be prepared for a mess if you're going to do baby-led weaning. They're learning, they're feeding the dog, they're throwing things, but we like a nice smock to try to limit the amount of mess. And I hope you have a good eating experience.
Okay, we have a couple of questions in the Q&A. I kind of wanted to ask a question, and a few of the speakers brought this up, but what were some of the things that you all learned? What were some of the themes around eating that you as a child learned? So I would love it if somebody could just put it in the chat. What were the things that you were taught at the dinner table? Because as somebody who was taught that you had to clean everything on your plate, that sticks with us. And so the idea that we are a product of our own family. I was wondering, because I'm a little bit older now, and maybe some of those themes that aren't the best to be learning are actually have kind of phased out. So if anybody's willing, any of the people on the call, to just put in what are the themes around food that you learned when you were young? I'm going to try to get, let's see. And then we'll get to the questions.
I think for me, just to
Yeah,
open that up
absolutely.
a bit more. For me, I know one thing was definitely, these are like reward foods, that these are, you have to finish, just like Helen was saying, that, chocolate chip cookies should not be the end goal, and broccoli should not be the thing you have to get through. I think the idea of giving the food a hierarchy, it changes the child's relationship to that food. So really just like Alex and Helen said, just offering a variety of things and seeing sort of what they choose. And then maybe the next day they choose something different, and sort of just trusting that and not placing any weight on that was a good choice, that was a bad choice. Just because I think us as a lot of adults, we have cheat days and we have, I can have this today. And those speak to unhealthy relationships with food. I know I catch myself doing that all the time, and that's not what we should be teaching our kids either.
Yeah, I mean, that's definitely something I would say was something, if you do X, you will get, and Helen definitely mentioned that. If you eat these 3 bites of broccoli, then you can have your cake.
And to touch on that point, I definitely came from the school of finish your plate, which is something we try to break of adults when we see them too. It doesn't help anybody if you finish your plate. And as Dr. Jani said, it's maybe offer the cookie in the middle of the meal. It's not a big deal. And something I try, like, if I'm eating it, why am I allowed to have it and she's not? So if we're at the orchard and everybody's having apple cider donuts, maybe Olive doesn't need a whole donut, but I don't need one either. So we can share together that bite. And it also changes the joy you feel around food. Growing up, there was not a lot of joy with food. And I think that's really what it should be. Family time, nutrients, and fun. You should be able to sit down as a family and enjoy without that pressure. Something else we don't talk about is like diet culture. I catch my family saying, going on vacation, we need to lose 5 pounds, or I need to look like this, or I was so much happier when I look like this. And as you can see, Olive's also she's a little bit of a bigger girl. So we don't talk about her as being, Olive's so chunky, or we try to stop that. Olive is Olive, and she has a body, and whatever she looks like, it's how she eats. It's not equivalent to morality or good or anything like that. She is built how she's built, and she likes to eat what she likes to eat.
Yes, I absolutely. And maybe some of the people on the call are dealing with parents who are saying, why aren't they eating this? Why don't they do this? So let's go ahead and turn to some of the questions. One of the first was that, you know, what are some things to begin at 5 months? You know, what were the first things that you guys introduced? And Stefan, you can chime in too, because you have an 11-month-old. Like, what were some of the very first foods that you served?
You want me to go first?
Sure.
Yeah, we started with purees. We started, it's like a mango, kale, avocado puree that she really likes. That's her favorite. And it's awesome because it's like really affordable and it gets like 3 feeds per box for its pouch. But and it's low in sugar, added sugars at least. So we started that once a day and we're now at 4 times a day with that and like a half bottle. But I was very excited to know that like we can start with water because I didn't know. I've been very scared about water. So half, no more than 4 ounces is what I heard. She's like a 2 ounce, like she's like a food serving and like 2 ounces of formula at this point, but I can switch to water. So I'll try that today.
Yeah, we actually started with mango too. I just pureed it at home. So the first week I tried mango, she loved it and she cried when we ran out of it. Now she hates it. And then, or like in the middle, she hated it again. And now like we just chop up a couple little mango slices. So she holds it. My daughter's a lot older. Well, she's 22 months older, so not a lot older, but she's a little bit more of a veteran with food now. And the second thing we tried was spinach, which did not go down well at all. I just steamed it and seasoned it ever so slightly and blended the whole thing up. She was not a fan. But, and just like Helen said, we tried it a couple of times in a couple of different ways. Now I'm able to give her some spinach and other things and she's happy with it. But the initial experience wasn't, she was not about it.
Yeah, and one of the things that one of you said was that there's eating days and not eating days. And I don't know who it was or what we read, but once I heard that, it's like, are they getting enough nutrition over a full week? It's not they didn't eat for breakfast, now we have to give them more for lunch. It was, are they eating a balanced set of nutrients? Do they have it? Yeah.
Yeah, and for Olive, she'd never had puree, so we started with avocados, bananas, sweet potatoes, and everything was what she liked to chew and eat and play with and figure out how it felt in her mouth. Also, Stephen, just so you know, water, she might not love the feel in her mouth and might directly spit it back out at you. So it takes some time, and especially like we started with an open cup. And then she loves her straw cup. But the thing is, the oral motor skills, which I'm not the pro, Aleksandra is, but they're learning to suck and get water, and then they will directly spit it back at you. And then they're also, now I'm in the opposite struggle. I'm trying to get her to like water out of a milk out of a straw cup. She likes milk comes out of her bottle, or me. So now it's coming out of a straw cup and she's like, whoa, that's not the mouth feel I'm used to. So it's a fun journey to watch them.
She's been coveting our water, so I'm excited to see if she really wants it.
So let me get to the next question, which is, my baby is 8 months old and I've been doing a combo of purees and baby-led weaning. Sometimes he wants all of it, sometimes nothing. And the question is, I've heard that carrots have a lot of nitrates. Is it okay if I feed him homemade carrot puree?
Yeah, absolutely.
And it kind of leads to the question that I wrote down about, does everything need to be absolutely organic all the time?
Well, do you eat absolutely organic all the time?
I don't believe
You know, right. So baby should, at the end of the day, baby should eat whatever it is you're eating. But just like Helen said, a modified version of that is just fine.
Right. And looking at ingredients, same thing like Dr. Jani said with an adult, we just try to see how much stuff is added now that we're on the go and taking her places, how much is added to it. We just try to pick the least amount of ingredients, which is the same thing I would tell any of my friends or family, is the less is more. So pouches and things, or is it just what it says it is?
And another question about baby-led weaning and this idea, and I love the idea of something being as long as your finger, but is there a risk if you boil some carrots and they pop that in their mouth with a little carrot stick? How do you keep it from it being something that they choke on?
So I can let Alex talk about gagging, but gagging is real, gagging is okay. Generally, kids will not choke on a food item. Learning choking and safety and precautions and back blows before you start baby-led weaning is important. Knowing how to get them out of their high chair fast is important. But babies will gag, and I'll let Alex talk about gag reflex and safeties. It's not like they're putting an AirPod in their mouth or a rock. You want to make sure it's food they can manipulate, but go ahead.
Exactly. And we know that the gag it's a protective response and starts to get integrated a little bit after 6 months. So, when you are starting to introduce those solids, you may see a gag. And I think sometimes what gets scary is the difference between my baby's choking and my baby's gagging, because they're learning how to feed. So I think, like Helen said, knowing those differences too, and knowing how to respond appropriately, especially when we're introducing solids, because we know we're going to be learning how to manipulate it. And if we do see a gag, it's not really responding negatively to it of like, oh my goodness, are you okay? It's more like, we're fine, right? Because we know that this is a learning process too. But when we are introducing those solids that are as long and wide as your finger, we want to make sure, like Helen mentioned before, that they are really soft and boiled. So then that way they are able to pick them up with that open hand grasp, put it onto the sides of their gums, because we don't really need teeth to chew. Our gums are super strong, right? And so once it goes into those side molars and they just kind of munch on them, that soft solid will kind of get into the middle of the tongue and they're able to munch and mash it, and it turns into a puree that they just swallow. So really knowing how to manipulate those foods to make them soft and boiled. And I think that also takes a little bit of time of learning how you're going to cook them, season them, manipulate them, boil, roast, steam. It takes some time just learning.
And something to add to that, which is crucial, which can kind of blur the lines when you have a baby who's doing modified purees and baby-led weaning together, which I struggled a little bit because sometimes grandma would watch Olive. You never put something in the baby's mouth if they're baby-led weaning. They decide what goes in their mouth, and we struggled a lot with that because she didn't want to try something and someone would go to put it in her mouth. It's giving them the autonomy and confidence to know what they're going to put in their mouth. Also knowing not to put your fingers in their mouth. Of course, there's emergency instances where you're going to sweep and hook a finger in, but otherwise you run the risk of lodging whatever's in their mouth back into their throat, and their trachea is much smaller than ours. So there have been times I have done the reach across to my husband to be like, let her figure it out. And when you get to the point where you think I need to intervene, this is going to be probably horrible looking on the Zoom, but your baby will also mimic you. So something we practice is, and I put my hand in front of her. So something that might get caught like a skin of a vegetable, she might just not like it and start to like gag because it'll touch the back of their tongue, but allow them the opportunity to spit and release something that's too much. You'll also notice them put far too much in their mouth. Even if you give them shredded chicken, they'll work through it and they'll spit out. Understand that, trust them to lead the role there.
Excellent. This goes also into how we all grew up with different food themes, but culturally it is seen as impolite to leave any food on your plate or to leave anything on the table. It forced a lot of overeating. So that's just one of those things that, and it's hard because you don't want to in any way insult anybody by saying that is a bad thing that you grew up with or a bad cultural thing. But it is really, really important to push back against some of those. My mom's was always, once I lose 5 pounds, I'm going to fit in that dress. And so that was one of those tapes. So I think it's really important to know where you've come from in eating so that you don't put those same tapes into your own children's heads. Would you agree?
Definitely. And I think, oh, sorry. And I think one way that I sort of learned to combat that about myself is just giving my daughter less than I would expect her to eat, and then allowing her the opportunity to ask for more instead of putting that pressure on myself. And I'm looking at her plate and I'm saying, she's not finishing it. She's not finishing it. And I know that's all in my mind, and that's the way that I was raised. And that's certainly not the way I want to raise her. So just offering her a little bit and then letting her ask me for more, I think that helps sort of combat that in a way.
Yeah, there's a really interesting question here. I started my baby with baby-led weaning when he used his fingers to feed him, and this lasted until about 2 years old. We tried to introduce him to utensils, but he didn't get a good hold of it until he was 3. During this time, I started to regret baby-led weaning and should have introduced purees and spoons so that he could self-feed. I have a second baby now. What is the right mix if I want to do baby-led weaning, but I also want him to be able to practice and use utensils early on so that he doesn't fight for using his fingers much later on like his older brother?
So you should be introducing spoons preloaded, like Aleksandra said. And now it's a little dangerous. I don't put my hands on the plate, but Olive is learning to stab with her fork because she's watching me, and she learns the concept of, if I stab this, I will get the food to my mouth. And she started, I have a picture up here on my desk of her using her spoon to her mouth. So it's just the introduction, again, understanding their expectations. They're not going to know how to use it. They don't have the developmental skills, but they have it on their plate. So she has spoons and forks and cups and plates. But of course, her little hands are faster. So her fun thing is to take her fork, put her food on her fork, and then eat it that way. So.
I think there's also stages of introductions to those utensils like we talked about before. Like there are those age ranges where you're thinking of starting to introduce them, but also knowing that when you haven't introduced utensils, it's not like, we're going to pick up the spoon or the fork and know automatically how to use it. Of course, we mimic one another and we're looking at how others are using it, but there's various stages to it too. That's why when you're introducing like a preloaded spoon, it's because they don't really know the concept of dipping yet. And that's like the first step. And then it's dipping and scooping and dipping and scooping and turning to the mouth. So there's different stages of introduction of those utensils. That's why it's important to also, introduce them when baby is ready, but also knowing that I think eating with fingers is also cultural, and a lot of people eat with their hands and their fingers. And it's also another way that we learn really what food feels like, because there are similar, sensations in the palm of our hand that mimic the sensations inside our mouth that our brain will process. Like, that's how the food's going to feel. Okay, so now I kind of know what it might feel like in my mouth. And I think, everybody eats in a way that they feel comfortable and would like to eat. So it's kind of just supporting best in that way.
I mean, it's an interesting question. When my kids were young, they had the little mesh teething thing that you put. I mean, is that helpful? I know it was helpful for the pain because you'd put something like cold blueberries in there. But how does that help or not help their development?
I think the one thing about those mesh feeders is, what's great is when they're teething, you can put something nice and cold in there, whether it's breast milk or other types of, let's say, crushed fruits, and it's frozen and they can use it for teething purposes. I think too, what's nice is it starts to learn those self-feeding skills of I can grasp this and bring it to my mouth. The other thing is if they are not yet have that gray around 4 to 6 months, right? We're still learning, we're still developing that core stability and that good head neck control in order to be a supported sitter for us to better start with solids. around that age range, even introducing those mesh feeders with different types of foods in it, they can get those tastes of the foods and start to taste different things other than breast milk and formula and help build the palate, self-feeding skills, but also in the hopes that they're stimulating various planes of their mouth to help the tongue start to move in different directions versus just forward and back. So I like to introduce those early on too, if parents are comfortable before we start to get to solids. It's a good foundation before we really start to introduce other foods.
Yeah. Here's another interesting question. Daycare puts the pouch, and I'd have a question about the pouch. Anyway, daycare puts the pouch directly in her mouth. Should I ask them to stop and use a spoon instead? Baby is 8.5 and we are doing just purees for now. We tried baby-led weaning, but the gagging scared me too much. So we went back to purees. So, and there's a couple questions in there.
The pouch, that is now the delight. We hated a pouch at first, but so I don't know if your kids had pouches, Susan, but whew, they are a delight. But it's okay if you're just doing purees. Sometimes it's difficult for the pouch too to get the strong enough suction. And Aleksandra, you can tell me, even Olive, like I have to assist her when she has it because she gets frustrated. She can't get the bottom end of the pouch out. So if you're doing purees, in my opinion, the pouch or the spoon, it's okay, either one. I wouldn't fret about that.
Yeah, I like pouches a lot on the go. If we're on the go or it's a nice quick snack, it's always great to have. The other thing is, you know, if we happen to be sitting down at the table or in the high chair, I would prefer for it to be in a bowl and a spoon just to help with self-feeding skills. But also when you think of from like an oral motor standpoint, sometimes the spout and the pouch can, like Helen said, they need really strong suction where they kind of overuse those muscles to get all of the puree out of the pouch out. Or that tongue is really sticking underneath that spout where instead of sucking, they continue to suckle the puree out of the pouch. And so from an oral motor standpoint, we wouldn't want them doing that too much. I think it's fine on the go, and there's no harm in using them at all. They're really wonderful, but I think, you know, changing it up a bit and offering it in a bowl and a spoon here and there wouldn't hurt either.
Yeah. And one of the people on the webinar says Munchkin makes a spoon that screws onto the pouch. So there you go. That solves your problem. And hopefully is there a environmentally friendly pouch yet?
Yes, we own them.
Okay, good.
Same.
Because that was the first thing I
Yeah.
saw, a little bit of applesauce. Well, we need to wrap up, but one of my questions, and maybe Stefan, you can chime in here as well, is say I'm having issues. I don't really know what I'm doing. My child is not eating much. Who do we call? Who do we contact at New York-Presbyterian Methodist to get information?
I would go with someone like Helen or Alex.
Exactly.
Yeah, I mean, I think that on the dietary side, you want to, you know, to reach out to a nutritionist or somebody who's certified in that area. If for the mechanics, you know, someone like Alex, and as far as like whether something is safe, like the end all be all of like, hey, is water safe at this point? Hey, is this thing safe at this point? You know, somebody like Dr. Jani, who's, you know, a pediatrician, because I know that for me, we had a lot of issues with conflicting information online with what we felt was safe as far as a fruit to eat, and at what time. And so we really just had to go to our pediatrician with a list. And there was also reactions that Ava had to, for example, rice cereal. There was this reaction of just a red face. And we were like, oh,
We had that.
no, what is this? We don't like this at all. And so we sought our pediatrician to give us the guidance. And the guidance was, you know, my face is red when I have a reaction, a skin reaction to wheat and gluten and those things. And so, you know, she just made the assessment by looking at my face and looking at Ava's that, you know, hey, yeah, not so much with the right theory.
Yeah, so it sounds like your first line of defense is your pediatrician, and your pediatrician can recommend people like Helen and and if you need to move on to that, because that may not be necessary. You know, you mentioned the differences of information. There are so many people on TikTok and Instagram doing these little videos saying this is how you should do everything. And I don't know, would you caution people to not believe everything you see on Instagram and TikTok?
I think you want to go for a trusted, healthychildren.org is a great resource because it's a lot of evidence-based backed material for parents and for caretakers. Your pediatrician is a great resource, and every baby is different. So a lot of the times, a lot of these things you do is different, even, you know, from a first child to a second child, the way that you approach a lot of aspects of their development is different. So, you know, a pediatrician would be able to guide you, and we'd be able to refer you over to a nutritionist, to a speech pathologist, depending on what your specific needs are.
Excellent. Well, we are going to wrap up. If there are any other questions, I would definitely say ask your pediatrician. We will put in the follow-up the information for all of the people who've spoken here today. We so appreciate your ability to take your extra time to make this happen for us. I mean, it can be a really anxiety-producing thing, feeding your kids. Are they going to eat enough? Are they going to be healthy? Are they going to reject food? The one other trick, I guess I would say, that we found was that my kids, who were very picky, ended up eating a lot of things they wouldn't have done at other kids' birthday parties. Just watching and being around other kids and watching them eat, not just the family, but other kids eat. That was really super helpful to us. So thank you, everybody. We will put a recording up if you missed any part of this. Happy eating. And in the chat, if you take a second, is there one thing that you learned that you'll take away from this that you didn't know before, that has helped you ease into feeding your child? I'd love you to all take just a second to tell us what you've learned.
And
So
thank you. And while folks are doing that, we need all of our facilitators to stick around for a group picture. Thank you so much, Susan, for your partnership and for each of our facilitators.
Well, I think we're on 12 years we've been partnering with you on great stuff. So I appreciate this really awesome partnership. So I'm going to stop the recording, and hopefully a couple people will put in the chat. Or I don't know, can they use the chat? I don't know.